Well, for more on all this, I'm joined by Will Humble. He's the Executive Director of the Arizona Public Health Association. It's good to have you with us on the show.
My pleasure.
So, the UK, as we heard, they're really embracing reopening with much looser restrictions. And here in the US, things are becoming much more relaxed. Are countries with high rates of vaccinations acting with too much confidence, or does the science allow for that confidence?
No, I think there are several things that we have learned over the last, well, really two things that we have learned and achieved over the last, I would say, 6 weeks. On the research end of things, we now know that people who have been vaccinated are at very low risk for transmitting the virus in an asymptomatic fashion. We already knew that they were at very low risk for bad complications that would result in hospitalization or even death. The vaccines in use in the U.S., the Pfizer and Moderna vaccines, are by and large, you have Johnson & Johnson as well, but those first two vaccines are 95% effective in the real world, not just in clinical trials. And finally, the states in the U.S. have, some states are above 60% of the population vaccinated. Here in Arizona, we're still at about 44%. But the key is that we have been collectively in the U.S. pretty successful at vaccinating the highest risk persons, mostly the elderly. And so all of those things put together suggest to me that the CDC made the right decision last week when they gave guidance out that if you have been fully vaccinated, that there's no reason for you to wear a mask when you're in indoor environments and so forth. It's been a controversial recommendation. I will say, as a public health official, I have been supporting that CDC recommendation and guidance, whereas many, if not most of my colleagues have been skeptical or outright opposing that CDC guidance. But I think the evidence is there that it was a reasonable decision.
It is in that sense, the science tells us that it is reasonable, but I was walking down the street this morning and I'm seeing people's faces for the first time. It's almost shocking, right? And the policies vary from state to state, from business to business, and we're almost being told to rely on an honor system. What do you say to people who remain skeptical about trusting these strangers that they are vaccinated and can be out in the open without a mask?
Yeah, well, I mean, that is right. That is one of the downsides about this system, is it is the honor system. But my argument is that, look, the honor system is okay at this point in the pandemic and in the U.S. because of the high vaccination rates, especially in the highest risk persons. And so if you are, for example, somebody who is immunocompromised and still vaccinated, you still actually are at risk of contracting COVID out in the field because somebody without a mask might actually not be vaccinated. And so it's not without, this policy isn't without risk, but I look at it in its totality. And for me, I think the benefits exceed the risks in that we need, at this point in our vaccination campaign in the US, we need to get more people in their 20s and 30s and 40s vaccinated. And to do that, they need to see that there's a tangible lifestyle benefit to getting vaccinated. And by saying to them, look, if you get vaccinated, you can have your life back. You can go out without a mask in these environments, to the theater, for example, which is going to be starting up this fall. So, I think for me, the benefits outweigh the risk, although, there are varying opinions, and I'm out on a limb, I think.
Right,
really,
but Will, I just want to quickly jump in here because, we talk about these tangible benefits. Yes, people can see it, but are they enough to help, the population that are still very vaccine hesitant? Because there are still large populations who remain loath to get a jab.
Yeah, so that is absolutely true. And the intervention, at least in the US, that works best for that is to get vaccine into doctors' offices, because people that still have questions about whether they want to get vaccinated or not, all of the studies show the same thing, which is the most trusted source of information for people that are skeptical about getting the vaccine is their healthcare provider, their doctor, their nurse practitioner. So one of the shortcomings that we have here in Arizona is that not very many doctors' offices actually have the vaccine. And when a patient comes into the doctor's office, has that conversation, the doctor's got to be able to close the deal with a vaccine right then and there. So that's what we need to fix in order to get to that population, at least in Arizona.
Information and immediacy. Will Humble, thank you so much for your time and insight.